Then we have sinusitis, which is inflammation of the sinuses. Again, basically, it presents with more or less similar symptoms, just like rhinitis. Uh, the mucus openings are obstructed, mucus accumulates, and with the blockage of mucus openings, one can present with nasal congestion. So, again, the symptoms, one will present with fever, chills, with headaches, uh, facial pain that is usually exacerbated or that is worsened by pending, pain or numbness in the upper teeth, pallorant or discolored nasal discharge can also be present. Patient can talk about having fatigue, sore throat, cough. If you have to do an X-ray, then it will show you opacification of the sinuses. Talk about opacification. Basically, that is opaque. Uh, um, there'll be opaque drawings on your X-ray because of now the accumulated or congested mucus that has accumulated within the sinuses. So, how to manage sinusitis? Uh, Again, antibiotics to manage bacterial uh, infection. You give decongestants, that's the nasal decongestants, just to reduce the nasal edema. Then corticosteroids, which are going to reduce the mucosal inflammation. You can do humidification, which is going to prevent nasal crusting and to moisten the secretions, because now the secretions have accumulated. So if you do humidification, sometimes just getting uh, uh, hot water that patients want to inhale, that will try to humidify the nasal linings to try to moisten those secretions so that now they can be expelled out. Sinus lavage or surgical procedures that will again help you to just clear out those mucosal accumulations. You can also do saline nasal irrigation, which will help you to clear the mucus, analgesics or antipyretics to manage the pain and the fever, antihistamines just to manage the allergic component of sinusitis. I believe we already know when you're talking about sinusitis, the itis, that is the suffix. Basically, itis tells us that that's an inflammation. So you are nursing care of this patient. Teach patients to humidify air so they can use steam inhalation or warm compresses. So get warm water in a bowl, try to inhale that. That's going to humidify the air, and that's going to basically help to remove out those secretions. Warm compresses will do the same. Avoiding tobacco, avoiding swimming, diving, or air travel are very essential, because with all this, then you're going to increase the accumulation of the mucus secretions within the sinuses. Uh, Nasal sprays, teach the patient how to make use of the nasal sprays, how to properly make use of that. Good rest is very essential for this patient. Good nutrition is very essential for this patient. Encourage the patient to maintain an upright or a Fowler's position. That's going to promote drainage of the nasal secretions. Mild analgesics will again help the patient to just manage fever if it's there. Fluid intake should be increased, because with increased fluid intake, it's going to thin the secretions, and that's going to help to remove out those excess secretions. Avoiding to blowing the nose or sneezing with mouth open, because now that's going again to increase or to be strenuous on the sinuses. Possible complications of sinusitis before we go to pharyngitis, we'll be talking about, sometimes can lead to brain abscess, can lead to chronic sinusitis. If it's acute sinusitis, can progress to chronic sinusitis. So it's all about managing the sinusitis and managing the complications, I mean, the symptoms as they get to present themselves.